One other area I want to ask you about, Dr. Saraf, and with my own background in infectious diseases, this is something that I think about a lot. And we know that immunization of children it's a standard mandated set of things. Schools require it, government requires it, etc. But I believe there are some newer types of vaccines that are becoming available. For example, the Gardasil vaccine for young girls and boys, but I know it's people focus on the risk of the human papillomavirus in girls and young women as a measure to protect against the risk of cervical cancer later in life, where I know, unfortunately, there are very high rates in India for this. Your thoughts on either Gardasil or other evolving vaccines that parents should really be thinking about for their children?
That's a very, very important public health concern actually for India, because the second commonest cancer in India is cervical cancer. And that is the unfortunate part. But the fortunate part is that we have a strategy to prevent it. And that is as simple as a vaccine. So Gardasil is one. There are two other vaccines in this particular area, and Government of India also has now finally accepted the recommendations of the professional bodies working in this area to bring it. So it is definitely a very important public health concern, and every parent should be giving to their girl child, because in India it's like more in girls, more focused on the girls. It is to be given. It should be given to both, but as per our country's guidelines, to women, to young girls 9 to 14 years of age, the first dose, and then after 6 months, the second dose. So for different vaccines, it may vary, but 6 months to 12 months, you can give the vaccine. If you miss the second dose, it's not an issue. You can give it till 12 months also. So that is the best part. In other vaccines, you have to be very careful. Here, after 6 months to 12 months, you can give the second dose.
Excellent. Thank you. So I think we've had a chance to look at a few very important areas for pediatric, for young child and adolescent health that are highly relevant to India and to Delhi. We've discussed the importance of nutrition and metabolic counseling screening from an early age, because this can very much set the trajectory in the adult stage. And we know there's so many of these diseases of lifestyle. We discussed the seasonal issues around the colder winter months, atmospheric pollution, and tremendous rates of asthma, which again disproportionately affect young children. And we've discussed some of the newer recommendations in vaccination that go beyond just the school entry and the vaccination against human papillomavirus to prevent cervical cancer, especially in women, young women, is a really important public health intervention. So all of these are examples of the role of a pediatrician working very closely with parents to protect that health and welfare of the child and to set a pathway of good health, for that child going forward. And so it's really just a delight to have you here at the dcare clinic in Chanakya, available for 4 sessions per week. And what you'll see on the screen are the contact numbers to reach Dr. Saraf to make an appointment. And please feel free to reach out and use these services and ask any questions. Dr. Saraf is part of a team here that really believes in protecting the health and welfare of the children. So thank you so much, Dr. Deepika, and have a great day. Thank you.
Thank you. Thank you very much.
Excellent. That's good. I think